Hi, everybody. Welcome to the Technology Evangelist podcast. I'm Dr. John Fluke, Technology Evangelist. And today we want to talk about things from a little different perspective. Um, my sponsor, Medidenta Digital, is really wanting to change the world of dentistry. And the way we're trying to do that is by bringing dental assistants more into the mix. So, along those lines, I have a lady that I have known for, gosh, I don't know, at least 20 years. She's rock star dental assistant and she teaches dental assistants how to be rock stars. Her name is Shannon Brinker. Shannon, thank you for joining me.
Thank you for having me. I'm very excited to be here.
Well, I really wanted to talk to you because the world has changed a lot in in the time that we've known each other. And you've always been very passionate about doctors, let your dental assistants do everything that they're legally qualified to do and that they're good at. So I always like to start off with an origin story, Shannon. You have been teaching dental assistants, you've been doing education, all kinds of things for a long, long time. You're probably one of those people that everybody's heard of before I introduced you, but give me your origin story. How did you get from wherever it was you started to where you are today?
It's a very funny story, actually. I worked for a dentist in Charlotte, North Carolina, that really was one of the first, I would say, PPO, DMO. We were seeing
Uh-huh.
50 patients a day. Literally, people don't believe me, but his name is Dr. Dest. And one of my trainers, I stole from him to come on and be one of my trainers, and we laugh and joke together. But we were on roller skates all day long. As a matter of fact, I remember feeding my x-rays, and we called it the prayer closet because we'd go in there and feed the x-rays through the, and we would say, oh God, please let us get through the day. Oh God, please let us get through the day. But I would tell you that I was hired originally to be the emergency roving assistant, which is so funny now. But I give him so much credit because when somebody says, "Hey, we need a roving assistant," they make it sound
Right.
so glamorous. But let's be honest, Dr. Fluky, 2 out of the 5 are left-handed. Oh my God! I told people you work for left-handed dentists, go ahead and quit because oh Lord, that was so hard. And then I think being called that rover, it really worked to my advantage because I had to learn so many products. I had to learn every dentist was different. And again, those two left-handed, you should
Mhm.
have seen me. You talk about an octopus. I mean, it was like, oh, I was the worst assistant ever, but I'm a good talker and I love people. And when we treat people so right, it doesn't matter what mistakes we made. That's the only thing that I
Right.
can say that got me through that in God in that prayer closet. But let me tell you, I learned so much there. And I remember I was like, man, this is a lot of people. I'm going crazy. There was an ad in the paper at the time. This ad, I swear, was this long. And it was Deborah Nash who wrote it. And it was Ross
I
Nash
just
and
saw Deborah a
Brad.
couple of days ago.
Oh my
It's
gosh.
funny.
Listen, if you ever need somebody to write an ad or help you with that, Deborah is the Mac Daddy of all that. Because let me tell you, that's what sucked me in, and she, that's who she is. And I
Yep.
said, "Oh my gosh, this is crazy." So I went there and Gary Rads was with him at the time and
Hmm.
they were delivering Miss Teen USA's veneers. And he told me, he said, "Now listen, put a lab coat on, don't say a word." I said, okay. It's like, don't talk, Shannon, because again, I told you I don't
Right.
talk. It was so hard. But I put the lab coat on and I was watching them deliver Miss Teen USA and I said, oh my God. I mean, I didn't know what a veneer was. I'd never seen anything like that in my life. But I was like, oh my God, I want that. I want to look like that. And that really started my journey of, just working with him and meeting so many amazing people at the Nash Institute. Being with Deborah was just icing on the cake. But most
Hmm.
importantly, really teaching me to do great with consults, to take what I love with people and be great with consultations. But he did let us do a lot of things on our own. And that was really, I think, Deborah in the forefront of saying, you know what, if we're going to hire you, you're going to work. And I
Right.
appreciated that. And I remember my first meeting, I was like, oh my gosh, he really is somebody. I didn't know he was famous. I mean, I knew he did these great patients, but it opened a world for me and I always give him credit, but my love for products and materials is what really got me in the door of continuously to always try to find the best products just like you and for really being an advocate of assistance because he had all these courses for dentists and I said where's the assistant course? And he's like, well, we don't have one. And I said, well, what are they going to do when they get back to the office? Because they weren't there at the class and they don't know anything about what they just did.
Right.
So everything that he did was very hands-on. And I love that because we're tactile people. We wouldn't be in dentistry if we couldn't
Mhm.
work with our hands. And this has really been the start of anybody can show it with a laptop. We got to train the team and get the team up to par. But most importantly, we got to add that tactical piece to it. And I feel like this has really been my journey is to get the knowledge, but also that skill set to the assistant. And how do we do that? And that's really been the journey. And he's the person that really got me there.
See, that's super cool. And I want to tell a quick story on Deborah, who's his wife, um, and just what kind of person she is. You'll love this, Shannon. Um, so everybody knows we're recording this in December, and I just got back a couple of days ago from the Greater New York meeting, and I was doing a program there through Connexient, and they're the people that publish Inside Dentistry and Compendium, and so they had these half-hour slots where they would invite speakers in to, briefly cover a topic. And I finished up, and as I wrapped up my course, Deborah was coming on the stage next. And so we're trying to unplug our laptops and plug our stuff in. And, she's trying to not get in my way, and I'm trying not to get in her way. And we're kind of leaning up against each other. I said, dang, Deborah, you smell great. And she says, oh, I don't even know what the perfume was, but she's like, oh, I love it. And I said, I got to try and remember this because I want to get some for my wife. And about 2 hours later, I got a text message from Deborah. It was a picture of her bottle of perfume that she took in her room
Wow.
and then sent to me.
Wow.
Just, I mean, just little things. That's the
It's
kind
the
of person.
follow through. I will
Yeah,
say that there's a lot of things, that she wrote us on. I mean, being honest, but at the end
sure.
of the day, we look back. I can remember even Dr. Nash making us take 500 to 600 photos on one patient. Who does
Right.
that? And Ava and I laugh because, I saw him at another show and I was teaching and he was walking. Somehow we saw him in the hotel, but it was like, wait a minute, we were just talking about him. And I said, I got to tell you something. I said, I don't give you enough credit because I said, all the times that we griped and you didn't even know about it, he said, I knew about it, about taking these photos. I said, I would not be the clinician I am today if you had not made me do that. And I think, the follow through, one of the things that Deborah, and that's why they make the best team because she said, all you have is your word. And when you tell somebody you're going to do something, you do it. And I think that those, just that foundation, because so many of us are office trained. I'm grateful for working with
Yep.
Dr. Ness, but I was office trained at the time. And I feel like, having that structure of people that really want to teach you, because like I do, you got speakers and you got teachers, and both of them
Yes.
together with Gary Rads and then Bob Lowe. I mean, oh my God, who
Hmm.
would fall into that? Michael Miller, Ron Jackson. I was in like a space where no one had ever been as a dental assistant, being able to have access to all of these people. But they were the foundation of that. And like I said, I always give credit where credit is due. And it was to both of them.
Well, and a lot of credit, not that this is the Ross Nash show, but no, a lot
Right.
of credit to Ross because he was a forward thinker. You would expect somebody, or I think most would expect somebody to be at that level with doing that kind of treatment and, people flying in because I want to come see you. I live in LA, but I'm going to come to you because, you're so great. That person realizing how important the team is. I mean, you would think that somebody like that would be like really full of themselves and all those people, that work with me, they're below me. But it wasn't that way. It was that elevating everybody, making everybody stronger, making you accountable. You got to work hard, but you got to do good work in the process. But trusting the team, trusting the process, and making all of you feel like we're part of this. We're making this happen. This is, it's not just his case, it's our case. And I think that is just so critical to, building a team, building a culture. People don't leave you don't come to work one day and say, "Ah, I mean, I'm getting chewed out every day. I never do anything right. And I can make $1 an hour more at Target. So what am I doing here? You don't get those kind of internal conversations if you treat people
No. The one thing too that I've seen over the years is, with all the changes, and I know we're going to talk about that in the dental
Yeah.
assistant area, is that he always wanted us to take other courses. So as a dental assistant, first of all, there's no hardly any dental assistant courses. That's the number one
Right.
problem. But the second thing that I will say about him is that they really pushed us to take courses. Now we're given courses, but they found, and honestly, nobody did it better than Deborah and Dr. Nash, because they always sought after what we were good at, and that's where we went. Like Ava, who's my very best friend, who's one of my trainers now, she was so good at lab work. So to spot what somebody does best and put them in that position is what's going to let
Mhm.
them soar. And so many good people came out of the Nash Institute. I will tell you, there was probably what 7 or 8 of us now that are speakers. Emmy Jameson, Greta Whitman, myself, Ava. I mean, there's so many people. Patrick Broom, who was his partner, Bob
Mhm.
Lowe. Not that they didn't have it before, but now they really, I mean, they learned from him. And Gary Rads, who was his
Yeah.
partner. But he found a way to make us feel like we could do anything. And that is really what drew me to you. Because I don't know if you remember, but I remember I always said, we got to find dentists who really do care about their assistants. And somebody's got to talk about that. How can we create a great partnership? Because, Dr. Nash, when we sat, his legs were in between mine, and we sat just like this in between the
Yeah.
patient. The only thing that separated us was the chair. And I told him, I said, sometimes I felt like I spent more time with him than Deborah, and we'd laugh, and I said, Deborah, you know what? I'm his second wife. And then she started calling me a second wife. We would joke about that, but it's so true because I knew his mannerisms. I knew his facial
Mhm.
expressions. I knew when it was like, okay, today he's really tired. So I just got to make sure I hand in the right thing so we don't make any mistakes. But he
Right.
relied on us a lot. And I think that partnership is what is missing in dentistry right now. And we don't have that. And we got to create that dance. That I will say, when I left Dr. Cranham, I mean, Dr. Nash, and I moved to work with Dr. Cranham, that's what he called it. And he always said, we have to have a dance. And our dance for many months was horrible because I compared him to Dr. Nash, and moving to
Yeah.
somewhere, moving to Virginia and then trying to think, hey, I know this person, I'm going to do great. I was a horrible assistant working for him out of the gate. And because we just didn't know each other like that, we have to find a dance. And I loved that because this is what's going to make assistants stay with you. That turnover rate is so high that we have to have some kind of fulfillment and doing some of the things that I love to do, because he let me be a treatment coordinator, but I also was a dental assistant. And I think that is what makes people want to stay. It's not even about the money, it's the appreciation, but making me feel like I'm as close to a dentist as I possibly can be. And that's what I loved about you, because I remember you made these shirts and you don't even know what I saw this. And then I said, oh my God, I love you right now. I don't even know you like that. And every assistant had a different shirt. And I was like, I said, Dr. Fluke, I don't know if you remember, I said, you got to put an article in the journal about how to be a better partner, and how to treat your assistants, because nobody did it better, I think, than you. When I saw those shirts, it spoke volume to me for Dental Assistants Appreciation Week, I believe. And I remember what they
Yep.
said. I just remember seeing your assistants with all different names on the back of the shirt. And I said, this guy has got it together. He knows how to keep your team. And that's the hardest thing. Nobody really talks about how to keep a dental assistant and what are we missing. And I think that is so true. It really is.
It's funny. I do remember that. The one thing I remember about that is I had at that point in time I had a great dental assistant who her name was Sam, or is Sam because she's still around. But her t-shirt said you can't spell awesome without S-A-M.
Oh my God.
I
I
was
love
I was proud of that
that.
one. That one just came out of the blue. But
I
um
love
yeah, it's and it's funny too because we've never talked about this before, but for my whole career, I always talk to patients about we're doing a dance right here.
yeah.
And I said, if you go back and you watch like Fred Astaire and Ginger Rogers, one of the greatest dance pairs in history, they both knew, okay, his leg goes this way, my leg slides that way, and we move in unison. And I say that, when I'm in the mouth with a handpiece, she's got to be at just the right angle with that vacuum to, let me see, keep you comfortable. And then when I move, she's got to move and keep that same angle and and I told myself it's like having a dance partner. And you kind of fumble a little bit with somebody new. Um, I always have told my dental assistants that the best compliment I can give you is I would normally work with just one assistant. We had lots of assistants in the office, but each doctor had an assistant assigned to him. And I always told the ones that I didn't work with very much, I know you're a good assistant when I don't think about, oh my gosh, I wish Nikki was here because, that flow and that movement and handing me what I want when I want it, handing me a syringe, bonding agent that's already bled, that there's a little drop right at the, and I don't have to like go fumbling for it and stuff. And that's so critically important just to do it right, doing it efficiently, not fast, efficiently. Um, yeah, it's critical. So you've mentioned a couple times trainers. Kind of tell me what you're doing as far as you've got trainers. What do they train on, and how do you do that?
So, many years ago, Invisalign reached out to me and said, "Hey, we're going to do a couple of courses." And I remember David Rodriguez coming into my
Mhm.
office, or came into my course actually, and he said, "Shannon," he said, "I got something good coming." He said, "I'm getting ready to take a new position, and I can't tell you who it is yet, but we're going to need some trainers, and you do the best records." Well, I was taught very well to do records with the Dawson Academy and working with John Cranon. We took all the photographs and everything we needed for orthodontics. And so little did he tell me that a couple of weeks later, he's like, "Hey, you're going to need about 10 assistants." I'm like, "Done. Train people, we'll
Mm,
bring the best ones." And then about 3 weeks later, "Hey, we're going to need 50." And I was like, "Are you crazy?" And then it led into 83. We ended up having 83 team members across the US and Canada, and three of them actually spoke French Canadian. And
wow.
it was amazing. And we were doing 7 hands-on courses a week. That's crazy. I'm the butcher, baker, candlestick maker because I was not only putting the presentation together because again we're assistants. We had hygienists, we had office team members, and so I would put the presentation together because we're sitting in the chair. We don't know how to do a PowerPoint, but
Right,
they learned that PowerPoint. They knew the clinical pieces, but we put people in the right position. So I think that had a lot to do with it. And then we just grew and grew. But then when COVID hit, it was like, what is my team going to do? Well, Invisalign ended up hiring 14 of my 81 trainers that moved on. Some of them are very famous trainers now for Invisalign. One of them is actually the director of education. Isn't that crazy?
oh,
So
that's cool.
yeah, and her name's Lil Hinton, and she's now the director of education. So the great thing is, I can say, kind of like Dr. Nash and Deborah, we really found what they did best and put them in that right spot. And so I learned that from them. But as we moved on, it was hygienists, assistants, office team members. But COVID again hit, so we said we got to get back to what we do best. Um,
Right,
and really said, how can we train these teams, train members? But we knew assistants' roles were changing already, but now it's at a rapid speed. So these pop-up schools, and no offense to pop-up schools, listen, I was office trained first and then went back and got certified,
right,
is that they don't have the time to train them in 12 weeks. There's no way. And then the other piece
right,
of this is my dentist friend saying, "Shannon, I think I could train them on my own." I'm like, "You can't." "No, I can, I can." And then they'll come back to me a couple times, "Shannon, I can't. You're right. I can't see a patient and then train them over the patient." Because he says, then
right.
it makes me look incompetent and then I'm hiring incompetent people. And then I had doctors that were saying they've been with me for a couple of weeks and I'm getting ready to let them go. And I'm like, why are you letting them go? Do they show up on time? Are they a good person? Are they good to the patient? Yeah. But they don't know my move. They don't know my next move. They're not fast enough. They don't know your move because it's only been 4 weeks. And those
Right.
are the things that I feel like drive me crazy. But so we said, what are we going to do? So we launched a CE in a box. It's not something new. There's so many different people out there that have done this where they have, models and materials and they ship it. But what we wanted to do was we said, listen, we could develop this. We call it CE in a box, where it's an online subscription. It's super inexpensive because listen, I'm an office owner too. I wanted it to be
Right.
where every person could say yes. And if the doctor didn't pay for it, the assistant could pay for it. That was my ultimate goal. Anybody can teach you a presentation, but when you got models and you have all the tools, you've got equipment, you've got instruments, you don't have to worry about it. The only thing that we don't supply is a cure light. But they could either, and I always tell doctors, if you do this, leave it in the practice. So this way, if you do have constant turnover, you've got something to train. Or what my friend Philip Talley down in Atlanta is doing is he lets them take the workbox home. He bought them a little motor. I said, listen, here's a cordless motor with handpiece. Let them take it home and assign them the modules, and you oversee it. I said, but if they don't work with their hands, there's so many, things out there
Yep.
that say, "Hey, I'm just watching you." It only registers, I think, like 12%. They got to do it. And so this is where now we can train the masses. Tomorrow I'm training 40 practices at one time. 40 practices at one time. This is what we're missing in dentistry. We have to have somebody that's going to jump and say, hey, and the one thing is not all me. I got to find the right people to, if it's endo,
Right.
that definitely ain't Shannon. If it's surgery, that definitely ain't Shannon. But we've got trainers now where we can find the experts in all of these areas, regardless of what the doctor is looking for. And the best part, Dr. Fluke, is that the doctor will see, did I do it? We assign the dentist to their subscription if the doctor pays for it. Of course, the assistant does it on their own.
Right.
We can't. But if the doctor's going to pay for it, we want to make sure that they're watching it. And I think it's definitely the future. I don't think I know. This is the future of training and real training because it's something that's hands on.
Well, one of the things I think that's always been lacking, and you hit upon it earlier, you said, that a doctor goes to a course and they see something great and they get really enthusiastic about it.
Sure.
Yeah. And then they come back to the office and they've gone to the course alone. They come back to the office and they're like, let's do this thing. Let's do this new thing. And from the dental assistant side, then it becomes a thing of like, well, how do we do it? Well, what do we do? Well, if the doctor's really good and took really good notes, they probably have a pretty good idea of how they do it.
Sure.
But yeah, I don't honestly like I don't know how to set up for a procedure. I mean, I basically know like I touch this, I touch that. I don't know how to put it there efficiently. I don't, I don't know how to hand it to somebody correctly because that's not my forte. And it makes it so much harder to integrate things. And then when we learn, the first time you do anything, you fail. And mistakes are where the learning takes place. I always say, you know what? The average number of steps a baby human takes before they fall is one, but we don't crawl everywhere. You learn next time, okay, I balance a little bit, I do this. And before long, you're walking. And you have to be able to be at least knowledgeable enough about what you're doing to know, okay, we do it like this, we look at this, oops, okay, that didn't come out right. So we do it differently. But if you don't have the dental assistant with that perspective of, either being with the doctor at the course, or maybe there's a course for doctors and then for the dental assistant, okay, let's look at it from your side of the coin. Even the perspective of looking at things in the mouth, it's different from, I'm right-handed. And, so it looks different from my side than it does for a dental assistant in the left side. By the way, little sidelight, doctors, when you set up your office, if you aren't in an office right now that you've set up, when you get your own office, set them up so that you can do either way. One of
Yes.
the best things I learned was when I was in dental school, I dated this sweet hygiene student named Michelle. Michelle was left-handed. She
Oh,
graduated from a hygiene school, and she went into private practice. And then we dated for a couple of years after that. And the stories she would tell of, oh my gosh, I had to go into this office today and the room's right-handed, but I'm left-handed. I was literally like shoved against the wall. I was trying to clean teeth like a praying mantis because I had no room for everything. And the only place that the instruments would go was on the other side of the patient. So I'm standing up and, leaning over the patient, picking things up. So when I built my office, I set it up with rear delivery, and all you got to do is move a couple of arms. And it doesn't matter whether you're right-handed or left-handed. I've got a left-handed hygienist that's been with me for I don't know, 20 years now. And her was identical to the rooms we work out of. And it's just so easy, but you don't think about that when you're setting things up. But
no, and we actually tell them about the get the dental assistant involved in the cabinetry because the things
yes,
that I loved when Dr. Nashby did his office is he said, "What do you want?" And I said, "Cabinets. I want cabinets all the way down this wall." I said, "I don't like to restock, and I'm not going to go back and forth, and I want everything to be right
right,
here that we need." And I'm gonna tell you, it wasn't even dental cabinets. We and if you look in my office right now, it's IKEA, big cabinets, big
right.
openings. Because I don't want to get up. I'm one of those, I want to have everything right here.
Right,
And like I said, sometimes doctors are like, "Ooh, this looks good. This is nice," and they didn't get their assistant's opinion on, "Hey, what do you think we need?"
right.
So I think it goes twofold. Absolutely. If you look at my equipment right now, I did the same thing. I said, no matter who's in here, I want it to be whether they're right or left-handed. We can flip that
Yep.
chair and move everything around, and I think that
Set it
is
up ambidextrous. Absolutely.
true. So
You
true.
know, the other thing, gosh, we're going to go down the rabbit hole on operatory design for a second, but the other thing that I did, so when I built the office, we had two kids at that point in time. And I still remember when my first daughter was born, um, my wife went into labor at like 2 in the morning. We went to the hospital. They checked her in. We took us down to the labor and delivery room, and we were in this that the room looked like a high-end hotel. It looked like we were in, like a Marriott Marquis or something. I was like, dang, this is nice. And then as my wife went further into labor, they were like, oh, okay, baby's getting closer. They started like sliding paintings on the wall and moving these things, and stuff started coming out that was all hidden.
Wow.
And all of a sudden, it went from, like this high-end hotel room to almost like a mini surgical suite. And you couldn't see any of the equipment. So that was the number one thing. I was like, that's what I want in my office. I want everything hidden. I don't want people seeing a bunch of pointy, shiny stuff. And then the other thing I did was I talked to the architect and I was like, what's the standard size of a dental operatory? And I don't remember what it was, but it was, I don't know, like X by X. And I said, I want it 3 feet bigger in both directions.
Love
And
that.
what was great about that was now you wheel a cart in, the cart just rolls right in. In the office I worked in before, if I had to go do a hygiene check and I had to leave, I had to squeeze between equipment and not, knock things over or,
Yeah.
put my backside in the patient's face as I'm trying to squeeze by. And those big operatories, it's such a difference. I mean, the hygienists and the assistants had moved room to move around. I had access to everything I needed. There are times when I'll do something and I'll need 5 foot pedals. Where are you going to put all, so you have all that room, and then it just makes the dental assistant's job easier too, because they're not bopping up and running around and, asking for something. Oh, it's next door, that kind of stuff.
I agree 100%. I love that. That's what I said too for mine. It's like I want to have enough room where I can move around, but most importantly, I feel like it also lowers the patient's anxiety. When you're so
Yes.
cramped, you're cramped. I mean, I've had a patient when I put a bucky and put an apron around them, they start panicking.
Yeah.
I feel like that does. And again, you don't know until you see. I think in dentistry too, we don't know that that's possible. And sometimes we pick people that design our offices for us that really might not really know those things. So I'm glad that you mentioned that. I think
Yeah.
that's important. We should be designers, for practices. That's what we'll do in our next life.
Well, it was funny. There used to be this commercial, and it was for like Kohler or somebody that makes like faucets and fixtures. And they had this great commercial where this couple was meeting with this famous architect, and he's like, "Oh, and this is the building that I built in Taipei, and this is, it's all this really cool stuff." And so then he sits down at his desk and he looks at the couple and he goes, what can I design for you? And the wife reaches into her purse and she pulls out this bathroom faucet and she goes, design a house around that. And anyway, and that's kind of what I did was I talked to the architect who did have a lot of dental experience, which was great. He's actually in Lee Summit where I practice. His name's Guy Gronberg. He's famous. But I told him, I was like, here's the operatory. I want it this wide, this deep. I don't want a bunch of stuff hanging over and going on. Design an office around that. And he did, And so I remember that when we moved in, the first day we moved in, we wheeled in a hard tissue laser into the op. And my dental assistant, Terry, got up and she's like, watch. And she walked all the way around it, next to the dental
Love
chair.
it.
And she was like dancing and look at this. Because in the old office, we got trapped. We couldn't do that. And,
Yeah.
you know, it just made setup and breakdown so much easier and all that stuff. Gosh, we went way out on a limb there, Shannon. Sorry about
I think
that.
that would be a great, even having him maybe on your podcast, because I feel like that's so important, to really think about it. The doctor and assistant kind of choosing together, like how to set this up and to make sure
Right.
it's efficient, especially because how many of us get to, a lot of times doctors will go into a practice they're already in, but then, it's like, hey, these are the things that I wish I would have known when I'm designing my
Yes.
own office. And I think that's really great that, again, it goes back to being efficient, and it does go back to the dental assistant having those efficiencies of being able to be close and us working better together. I always say,
Yep.
color coding things and having drawers that are very clean and all the same. It really all goes back to that efficiency as well and being a good team, and having
Yeah.
what we need. It all is the same road. Everything is really and truly from start to finish has to be the right way. So I think that it's good to talk about.
So let me take us off in a little bit of a different direction here. One of my passions is in-office fabrication of things. And I really feel like the profession is right. I mean, we're right at the edge of a cliff. We're just teetering and we're about to go down. It's like being on a roller coaster, and you're like ka-chunk, 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 and you get to the very top and there's kind of a pause and then whoosh, the ride begins. I think that's where we are with in-office fabrication. And one of the things that I talk to people about and people talk to me about is okay, but I have a lab. A lab, we do a scan and we send to the lab and they send me back an occlusal card. I don't have time to be the lab. I just want to do what I do as the doctor. And then, of course, my response is, well, you can still just do the doctor part of it, spin your auxiliaries up, and let your dental assistants do what they can do with their knowledge. So, I mean, my big thing is you don't have to be a lab tech. Have your dental assistant do what they do and spin them up and let them do that. How do you feel about that?
Oh, 100%. Listen, that's been huge, especially in this day and age with the younger assistants coming out of school. They can do so many things so much better than me. And you don't know what you're missing. But the thing is you're absolutely spot on. I've got practices where they have an assistant that does, the assisting with the doctor, but then the doctor hired a younger assistant, not to say anything about us older assistants, because they're not scared of that technology. And
Right.
sometimes if you can find that person that pays a little bit more attention to detail. A nail technician is always preferred. I can tell you, I've got a dental assistant
Yep.
that did nails in high school, and I said, "Oh my God, you will be great at doing this." And that's the thing is, I think, assistants really want to feel needed and have again, a way for them to really showcase. I think every dental assistant has some kind of craft. And something, or we wouldn't be in dentistry. And I think that we just got
Right.
to find it. I do 100% believe that. And we are crafty people. And this just allows us to showcase our craft. Now, it's hard if you're the only assistant, I think sometimes, finding the time to really do those things. And if you're not working on a Friday, I got one doctor that he only has one assistant, but she does all of her lab work on Fridays. And I think that's great. And as you grow, as you grow, you're going to need someone to really do this. But my gosh, you think about the money of having to send something back and not being able to make changes. But most importantly, you're elevating that assistant. The problem in dentistry is we're not elevating the assistants, find out what they do best, and giving them that title to want to continue. Again, it's always not about the money, it's about feeling needed. And most importantly, showcasing again something that maybe no one ever saw in me. And I think that is something that, we don't think about as clinicians is finding the right person, finding out what their skill set is. Do they like technology? Is this something they can do? And again, having the great training. My gosh, I will tell you that if you go into a lab right now, and you already know this, when I go into the model and die room, every person in the model and die room is a dental assistant or was a dental assistant at some time in their life. And it's like I've asked Buddy from Bayview, which is my lab, and I'm like, Buddy, how did you find these people? And he says, Shannon, I got the right training, but again, assistants, you just give them a little bit of an uplift, and oh my gosh, they'll show you everything. And I said, you are a smart man. And every person that's in that model and die, we are very, tech savvy. I think most of us, because we have to be, but most importantly, we pay attention to detail. I know what you want because I work with you at the chair. And there's no way that a doctor can do all this themselves and really grow into doing a lot more than just a whitening tray or, again, a night guard. Because eventually, if you're making this kind of investment, there's so much you can do now that again, I'm not against you. I love my lab. Listen, they're going to do
Right.
all of those restorations, but there's so much that we can do now. And most importantly, with the orthodontics too and the software, they just need the training and let them run with it. You want to keep somebody the rest of their career with you got to make me feel like you really need me. And I think this is, again, going back to what's missing. And I tell you what, the dental assistants will soar in this arena because they already are. There's so many offices that have and see this, and you're one of them, right? So I think that's what we got to get the message across is, doctor, you can't do it alone, but you need to have a good assistant that can run with this and really do the job for you.
One of the best feelings that I get is so we have 3D printers, but we also have a mill. And I had the mill first. And one of the things I love to do was in that environment, I called it prep and go. So we've got expanded functions assistants. I would sit down, I would prep a single unit crown. I would leave. Dental assistant would plop down. She'd orient the scanner so that the patient could see the screen too. She'd do the scan. Patient would watch that, which they think the first time they see that, they think that is the coolest thing they've ever seen. And then um, sometimes we would do the same appointment, but sometimes we'd actually have patients leave for a couple of hours and then we'd text them, okay, it's done. And so whenever I did the check, now let me back up. Hey, the dental assistant would scan. I'd check the scan. They'd let me know, hey, I'm done. Look at it. Okay, it's good. And then when the patient would have the crown seated, dental assistant would, seat the patient, try the crown on, do anything that needed to be done to it, make the adjustments, take a bite wing, come get me, say, take a look at the bite wing. I look at the bite wing, it's great. Okay, I got to go check it in the mouth. And I'd sit down, I'd look, and it was perfect. And and then I'd say to the patient, I said, she tell you she did this? And the patient was like, what? And okay, so, I drilled on the tooth and then she took the scanner and, she created that digital file. Then she took that file, she put it in the design software. She made that crown. She actually designed it on the screen in 3D. And then she took it to this machine that's basically like a robotic thing with like hands and drill bits. And it takes a block of porcelain and it cuts it into the exact shape that she created. And they look at the dental assistant and they go, you did all that? And, dental assistant normally kind of hang her head, sort of kick the ground or something. Yeah. And the patient would be like, that's the most amazing thing I've ever seen. You can't lose her. You got to hang on to this one. And that feeling of watching those dental assistants get those accolades, what a
Yes.
great, I mean, for me, what a great feeling to see them enjoying that. Yeah,
I
and,
love it.
and they don't start thinking about, I could make $1 more an hour at Target, just swiping over the barcode thing. It's about training people and elevating them, but they're so good at it. I hardly really had to teach them to do anything. They could just tinker and figure it out. Um,
Right.
I even told him, I was like, I'll pay you. You want to watch videos on designing things at lunch? Hey, I'll pay you for eat your lunch, watch videos, go home at night, put your kids to bed, watch some videos, keep track of your time. I'll pay you for that. And they just did it.
I
I
love
didn't
it.
really have to do much at all. I'm still not a lab tech. They still
Well,
design better than I do. And
I,
and
I
I'm
love that.
glad for
You know what it does, Dr. Flukie, though? It tells the patient you hired quality people. A lot of times we're looked down on because, again, when we think about hierarchy,
that.
we're the last person on the list. And that's why every assistant usually, like you said, hangs their head, because we're not lifted up. But the thing is we are very smart people if you
Yes.
have the chance. The other thing is you gave them a chance to soar with training. You told them, hey, I'll take care of that. It's pennies on the dollar for them to watch videos or to send them the training and to elevate them. But most importantly, letting them shine. It's not me, 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 and I love
Right.
that because again, these are rock stars, and if you let someone go that is a rock star, somebody else is going to see it and they're going to make them a rock
Right.
star and you miss out. And I think that's really important. But again, we're not just that person anymore. A lot of times patients, when we say, they'll ask me, are you the hygienist? I'm like, no, that I'm assistant. Oh, this is what we
Yeah.
get all the time. And we have to stop that because I said, no, I don't work as a hygienist. I work with the dentist. It's still and so when what you've done is you've showcased her or him to where, wow, you made this. And I think this is one of the pieces that again we're missing with this whole technology CAD CAM from, also digital printing. It's elevating the assistant to not just be the person that's suctioning at the chair, and giving us that lab technician kind of label that I think
Yep.
is brilliant. And again, this is not to say, well, Shannon, how can I get my assistant to never leave? Well, you just answered that here. And I feel like, the investments now, we see these printers going down, the cost is coming down. But, having good training, but most importantly, elevating them, it's really the answer and it's the future.
Well, you think about it, Shannon. I mean, you know a lot more dental assistants than I do, but I've never met a dental assistant who said, I woke up this morning and I said, yay, alginate, and yay, mixing stone, and pouring it in a mold, and then trying to pop the tray loose without breaking a tooth, and then breaking a tooth, and then oh my gosh, now I got to fix that, and super gluing things together. And nobody looks forward to that. They're like, okay, I love what I do. That's the part that I don't like, but I'll do it because I love the rest of it. I mean, giving people the opportunities, and I mean, plus just the ability to get things done faster, to get it done exactly the way the office wants it. I think everybody in practice at some point in time, sending something to a lab, things get confused. It's happened to me probably two or three times in my career where I actually got a case for the wrong patient. And you open it up and it's Mrs. Jones, but it's Mrs. Jones that needs an occlusal guard. And I got Mrs. Jones flipper for, something else. Because it happens. You don't have that when it's in your office. You've got all that control and all
Absolutely.
that speed right in front of you. And then you've got the dental assistant who basically can do it all for you. You
Right.
know, that's
Absolutely. It's
that's
smart.
the recipe.
Exactly. It's smart. And like I said, we yearn for doing other things that really help us to grow. And I think this is where, again, going back to the doctor, having a really good assistant, but most importantly, knowing I'm not going to do all this myself. I need a good partner.
Yeah,
But that's the future. If I tell a patient I'm going to take an impression, they look at me like I'm crazy now. It's like, wait a minute, why are you not up to par? You think patients are dumb? They're not. They
right.
know the dentistry is where dentistry is. I think a lot of us just feel like, oh, patients really don't know. That is not true. They know. And those are the doctors they're going to be seeking out. And especially cases like yours, where I know I can go and get my dentistry done in the same day. Every one of us wants that. Nobody wants to wait 4 weeks, 6 weeks for
No,
restorations anymore. That's
no.
ancient, right? We just gotta. I think the reason why dentists get scared and why they're still doing it is because of the training and just feeling like
Yes.
who's going to train them. And I feel like now we're in a stage where we have training for that. We can go through this, doctor. We can help with training, but most importantly, getting that assistant to do something other than just sitting at that chair and suctioning is really
You
the
know,
answer.
I had a big epiphany a few years ago that goes in with this. So I was doing some hands-on endo courses for Ultradent, and we were going to do one in Kansas City. I have a conference room built into the office. And so we were going to invite a small intimate group in, and we were going to do hands-on endo cases, blocks. We were going to do them in my office. And I asked them, I said, hey, can I have a course for my team? Just can you get the equipment here like a day early? So they shipped the equipment in a day early, and we closed the office at noon. And we were going to have to set the room up, for Friday anyway, but we closed at noon on Thursday. And I let everybody in the office, the hygienists, the dental assistants, and even the admin people, I let them do root canals on plastic blocks.
Wow.
And it was so funny. because, I mean, I'll admit my ego got a big boost out of this, but they were all like, wow, this looks pretty easy when you do it. I'm, like I've broken an instrument or I can't figure out how to do this. And so it was, I don't know, it made me feel good, but it also gave them, the perspective of what it's like, just like doctors, I think oftentimes need to think about like, what's it look like from the assistant side of the chair? Can they see? Do they understand what I'm doing or whatever? I think at the same time, it helps the dental assistants sometimes to do things, in a practice situation that they're not allowed to do, and let them see that, yeah, this isn't really as easy as it looks sometimes. I think it just brings us all closer and puts us all together. I love your thing of the CE in a box because, even if I'm a dental assistant and I'm not expanded function, so I can't place a restoration, just being able to do it and see how it's done and understand it from that perspective, I think is a great learning experience. And at the same time, if you can't, if you're not legally certified to do it, you may realize this is fun. I like this. I want to go ahead, and get into this further and actually get my expanded function certificate. I think that's
Absolutely.
neat.
I mean, anytime we were in school, we had models. I mean, you got to practice
Yeah.
on a Dexter. It's the same
Yep.
theory. And the thing is, they can reorder the teeth, they destroy them, we reorder them. It's the same thing. And the way that we're doing it now is, every month they get different materials, they get access to that along with their subscription. Because these manufacturers, they know it's hard to get their products into those hands of the dentist,
Right.
but who places the order? We do. So it's
Yep.
like, okay, let's get them every month. There'll be a different procedure, a different add-on. And I feel like this is really the answer. I think it's something that, when you think about having the money that you have to spend in order to send your team to a course, and there's not that many, we were talking about that. I feel
Right.
like this is the way that we're coming to you. And like I said, they can watch it. We also have live as well a couple times a month. And all they got to do is just sit there with their models and their materials, and we're ready to go like tomorrow. And so I feel like this is again the future. I think that for doctors, like I said, that don't have the money, that really can't, and I know what that's like to pay for flights, hotels, and the
Sure.
course. Here you go, doctor. This is easy. We can just do it right here in the
Yeah.
practice. So again, we think that it
So
would really be a great thing.
real quick, give me a little peek the curriculum. Like what kind of things are you teaching them?
So right now, probably our number one is attachment placement because Align doesn't teach any of that anymore. They just
Right.
assume we know it, and it's not just about Align. There's so many multiple aligner companies out there that have
Yeah.
attachment placement, but it's the attachment failure. And so we were like, this was probably the first thing we were asked to do was, can you teach that? So yes, we are. And tomorrow we're doing 40 practices where we have orthodontic models that have attachments, and we really take them through what happens if how to place it properly, but what happens if it comes off. And then most importantly, how do we bond attachments to porcelain that nobody talks about? Because
Right.
at some point we're going to have to do that, but no manufacturer talks about it. And so we've got to give them those tools to be able to do this. Then we get into provisionals. That's probably probably what I'm most sought after for provisionalization. But we have anterior, posterior. We take them through single, multiple, single unit, 2 unit, 3 unit. Then they go through 4 unit. Then they go through implant placement provisionals. We do veneers, 6 unit, 8 unit, 10 unit. And they have double arch so they can check the bite. We can look at all of these things. So as they graduate through each module. Let's say I'm brand new or I've only been doing provisionals for a year. They do a single unit. Then we see they passed. They went through. They did everything. They showed us what it looks like. We got an approval from a doctor. Hey, it looks good, Shannon. They did great. All right, you get to move on. We're going to send you the 2 unit and the 3 unit. Then they move on to that. So it really and truly is very structured. We're not just going to give somebody out of the gate. Here you go. Here's an 8 unit case. We want you to fabricate it.
Right.
But we do feel like, everyone is a little bit different. So we have one for sealants. We have a lot of hygienists right now that have dental assistants who are their assistants, a hygiene assistant. That
Hmm.
curriculum was partnered with Amber Auger. She really helped me a lot with this because I wanted a hygiene perspective. So we teach them how to place fluoride. We teach them how to do a prophy. We teach them how to, really do all of the things, sealant, proper sealant placement, not sloppy sealant placement.
Right.
Believe it or not, that is huge, even in pedo. But most importantly, those hygienists that do have their own practices, this or even working with a hygiene assistant. So it really is graduate. Rubber dam. Everybody hates rubber dam. They hate it because they don't know how to place it properly. So with these kids, we're like, now listen, we're going to give you all the clamps. We're going to give you everything that you need to practice. But doctor, don't let them go in there and start taking pieces out because you couldn't find a certain clamp. It needs to stay in the hands-on kit so we can continue to do the training. And I think that's really important. But we've got just about every single area covered, honestly, except for endo, but we're working on it. And we want to add surgery to that. We want to add perio, but right now we want to get those basic pieces down to where anyone can do more training. I am not the expert of everything, but I've always said if I surround myself by very smart people and I want to learn the things that I know I need more, I need help with, right? Especially surgery
Right.
and endo. And so I think that this will be a way for assistants who don't have to, verbally say, hey, I'm not that great, to say, I'm going to practice. And I think this is what we know this is really where it's at, is getting them back to that hands-on component.
It is. I worked with a dental assistant for a long time, and one of the things that she really spoiled me on was we could do, let's say we've done a quadrant of composites, and I would prep them all. And when I was done with the preps, so we've got four hygienists, four chairs of hygiene. I'd get up, I'd go do some hygiene checks. I would come back and she would have the rubber dam placed, all the sectional matrix or matrices placed, wedged, rings in place. And when I walked into the room, she'd be sitting there giving me the look and that and holding the syringe of etch. She's
Wow.
like, let's go. And
Wow.
yeah, I mean,
Worth
that
its weight
kind
in
of
gold.
thing.
Worth its weight in gold. I mean,
Oh,
you
I
think about
I
the
don't know that
time.
honestly I could have done it.
Yeah.
I'm like, how do you do this? And she's like, just shut up and stick the composite in there. And that's what you need. That's, you got to trust them to do it. You got to spin up and teach them how to do it. There are some amazing people out there. I love the fact that you do this and you're doing it in baby steps. I love that expression. You can't eat an elephant with one bite, but you can eat an elephant one bite at a time. So, like you said, don't throw a 4 unit bridge at them right out of the gate, or don't, gosh, provisionals are so critical in cosmetics. You can't be traumatizing the tissue. You can't have the margins funky. And then, when the patient comes in for the final cementation and you pop the temps off and the gums are bleeding. And, I mean, that's just so you gotta, each step's gotta be right. So I love that. And I don't I don't think I've ever heard of a course for assistance for anterior cosmetics.
It's not. I mean, we break it down to all the way where, I mean, we had to take out like the cordless motors, and listen, there's
Mhm.
a lot of manufacturers like Pascal is giving them all the instruments as a part of it.
Wow.
They know that once that doctor touches that instrument that's
Yep.
handed by that assistant, you're gonna love it, you're gonna
Mhm.
buy it, and they're right. I mean, these are amazing instruments. They're all black. I mean, the scissors is amazing. It's not like that scissors that you use that won't even cut butter. And
Right.
a lot of manufacturers that we're bringing on, like Avoclar saying, "Hey, listen, I'll give you everything you need in that kit." Ultradent, we have DMG. They're giving a $365 cartridge along with everything else. So we've got some great manufacturers that are part of it, but we got to practice. How am I going to learn at the chair? I'm never going to be efficient if we don't. And so I know that this is really where it's at, and they can do it on their own time too, if that's something that they need
Yeah.
to do because you're so busy.
Yeah, you're not, like you said, you're not shutting the office down. So, you've got revenue coming in. You can do it at your own pace. So if a patient cancels, doctor, is busy with something else with another dental assistant, I'm going to go back and I'm going to do a course for the next 45 minutes or an hour or work on it, do my homework. That's That's tremendous.
Yeah.
I think you're right. I think it's where it's at. And
Yeah,
then,
we're trying to think, how can we help them?
yeah,
It's hard for them to get to us. I can
right,
only go so many times. And the problem
right.
is just not enough dental assistant trainers out there. There's none, and I remember telling MTS Manji at Spears, I said, if I don't go out, who's going to teach them? And, I
Hmm.
can only go to so many places and I'm getting older. But I said, we got to find a way to get it to those assistants because they are rock
Yeah.
stars. Can do that. You just have to give them the time to practice. And I think this is, again, the answer.
So do you do any kind of courses yet? Because I know how you are. You're a Spitfire. You'll do this. Are you doing any kind of courses now with teaching like 3D design at all?
It is funny that you said that. We are trying to think, how can we build? So our kits really are subscription based, but how can we build a kit where they have everything that they need? And so I've been actually working with Avoclar on this first. We were talking about the CAD CAM and the staining and glazing
Right.
kit. They have those
Yeah.
already. And so I flew up to Buffalo to meet with them because I said, listen, we really want to take this from, CAD CAM, but also having that
Right.
same kit
Hmm.
that we can kind of build. But most importantly, we got to have some training on this because, like I do, the manufacturers don't give us the training whenever we're purchasing these equipment. They want us to watch things and they're not really giving it to us. So I am
Right.
really hoping that we can really streamline this and have more training and absolutely because how are they going to get it? The first thing I thought of was, first of all, we need to know more about anatomy. They don't even, a lot of assistants don't even know for sure how the teeth come together. So occlusion is something
Sure.
that totally isn't taught. But I feel like absolutely we have to have that training and doing some of it in a box, just like we're doing, but most
Hmm.
importantly, doing some virtually live and taking maybe a
Right.
handful of assistants on a Friday. Some offices are done on a Monday. And so now what we're trying to do is just work out that scheduling calendar. Or maybe we can say, hey, doctor, can we finish at 4 on this day? And giving a couple of days a month where they could maybe pre-schedule it and say, hey, doctor, I got to be off at 4
Right.
because I'm going to do my laboratory training or do my, digital printing training at 4 o'clock to
Sure.
5:30. And I think that's really what we want to hone in. And so I would love to have, your thoughts on some of that and really having more of that training because that
Yeah.
is really the one place that is so desperately needed at this point.
Well, what I'm kind of envisioning is something where, like for let's I'll use 3D printing. It's an investment in time and it's an investment in money to do that. And I think there are offices out there that are like, we're not sure, none of us, a doctor or assistant are sure that we can do this. But if there was a way to design some things and then maybe when you're done, send us the file. The manufacturer will print those files, send them back to you. You can actually see what it is you designed, try it on your model. No matter what it is, it doesn't have to be a crown. It could be a retainer. It could be a
Absolutely.
flipper, but just giving people that feeling for, I can do this so that then when they do purchase, now it's like, okay, now all we got to do is we just got to learn, the actual process of printing it, but already know how to make it. And that's the hard part. The making it is much more difficult than the actually putting it together. So
Absolutely, absolutely. But everything in dentistry, this is what I just told even an assistant last week. I said everything in dentistry is repetition. The more we do, the better we're going to be, the faster we're
agreed.
going to be. I remember the first time I designed a whitening tray
Hmm.
with my software, I was like, oh my God, because I kept thinking, I've got to make the block out and it's not perfect. I must have
Yeah,
spent 5 minutes making sure I had the right pocketing effect. And I was thinking,
sure.
then when I hit the button, it was like, oh my God, I didn't have to be so perfect. But I
Yeah,
feel like this is where, again, just knowing now, okay, I can really get through it because I've done so many now. It's like boom, 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 boom. I mean, and again, it gets back to
yeah,
that fear factor at first. Oh my God, I don't know if I can do this. To again, doctor, remember, everything we do is repetition. I'm going to get better and better and better at it. But if I only do one a month, I'm never going to be good at it. So this is where we
yep,
gotta, you made the investment, we gotta use it. It can't sit in a corner.
yeah,
So I feel like that's the hurdle. But I love that. I never really thought about going ahead and making it for them and then sending it so they could really see this is what you designed, this is what you made. And I think that will be when the rubber hits the road. The doctor will be like, "Oh my gosh!" So thank you. I love that. I think that's a great
yeah.
idea.
Well, honestly, it just came to me as we were talking, but I think it makes good sense because then you don't, oftentimes when we make, a purchase of capital equipment, it's not only now we got to learn it, but I think in the back of the doctor's mind, the doctor's like, we got to pay for it. It's got to be running. And one of the things that I've noticed with people is, and you of all people will understand this, is that I say when we are actually with a patient, because the patient's awake, the doctor and the dental assistant, we are performing, we are on stage. If we look like we don't have a clue or we look like we're unsure of ourselves, people pick up on that.
Absolutely.
And what happens is if you do something for the first time, and you're always going to have hiccups, if you have a hiccup and it's suddenly starting to take longer, the default is do it the old way because that's the comfort level and we know that works. And then that just makes it easier to say, okay, we're not going to do that anymore. We're just going to do it the old way because we tried that, it didn't work. And then that's when things become a coat rack. Um,
Absolutely.
so I always build in more time. I always tell patients this is like the third one of these we've done or whatever. So it's probably going to take us a little bit. I want to know that ahead of time so that their expectations are set. But just being able to have benched it and practiced it and know that you can do it makes a huge difference when you actually perform, because then you're
Absolutely.
doing it with a comfort level.
Absolutely. And
Yeah.
I totally agree with you on that. And I think that again, just really having that say so. I mean, one of the things that I remember Michael Miller told me, he said, you have to do something 5 times before you can really just, he always talked about, us poo-pooing a product, giving it a bad
Hmm.
thing. And a lot of times that would happen. And we try something one or two times, oh, this is horrible. And he would say, no, you got to try it at least 5 to 7 times to really
Yep.
think about it, sometimes 10 to really have a good perspective. But the last thing you want to do is invest in something like a digital printer, a digital scanner, and never use it. What does that say?
Yeah.
I mean, you're making that payment every month. I mean, oh my gosh, we have to do it. But the thing is doctors will always say, well, I'll be the one to do everything. It's like, no, 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 no. Out of the gate, that's the wrong, I think, perspective is I got to have the right person to do it, and then we can
Yep.
do it together, and we can just roll with that. And again, that's what assistants
Yeah.
want to do. I mean, they want to take more of an ownership role in the practice for doing something like this. I think the sky's the limit for them and the practice. And then what comes back is huge.
Well, and we're getting close to bumping up against our time, but I do want to bring one thing up is I'm a big one on what I call buy-in. And so what I do is if we're going to change a process, like if we're going to bring a 3D printer in, what I do is we have usually it's like a 2 hour staff meeting, close the office for those 2 hours. I bring lunch in. I tell the team normally, sometimes I don't, but normally if it's something big, I'm like, okay, I'm thinking of bringing in a 3D printer or whatever. And I ask, okay, each department, admin, hygiene, dental assistants, think about that. Think of your questions, come up with things that you think are good about it. And then more importantly, come up with things you think are bad about it. And then when we meet, everybody brings up their points. We discuss them. And oftentimes, as we discuss them, the things that we thought were roadblocks, somebody says, oh, no, 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 we could do, and it fixes it. And then what happens is when we actually make the investment and bring something new in, everybody's on the same page. Everybody's excited about it. It's not like the doctor ran off somewhere and came back and said, "We're doing this new thing," and everybody in the staff goes, "Oh my gosh, here we go again. We don't know what we're doing." If you get everybody excited about it and everybody agrees, yeah, that's a good thing. Let's do that. Then you all start pulling on the rope in the same direction, and it just leads to better successes.
Absolutely.
Not
Absolutely.
that hard.
It's not
All
that
right.
hard. And I think the team should have a say so in that big of a purchase of, what are the pros and cons? Because right at the gate, you might get some naysayers if you just do that. Absolutely. Oh, here he goes buying another toy, or whatever.
Yeah.
It's like, no, how can we make this work? And I think having different opinions, especially, getting everyone's ideas is smart, very smart.
Well, and the other thing about bringing new things in is oftentimes whatever that new thing is, it's got a much greater impact on the workflows of the team than it does on the doctor. I mean, the Crown and Bridge in my office, I said I prep basically and walk away. So it doesn't really matter to me, if the dental assistant took a physical analog impression or digital. I'm not doing that. They're doing that. So, I think sometimes doctors forget about that. They forget about the fact that, oh, you know, I've just changed things up on the team, but it doesn't really have an impact on me. I'm still going to go home with my same level of stress and everything else. And I've kind of thrown them to the wolves. So anyway, just talk to your team, get them on board, listen to them. And it's just so much easier.
I agree. We always say, and really just being honest, when I'm teaching my courses with assistants, they'll say, if he just would have listened to me, he wouldn't have had to pay somebody $25,000 or $50,000 as a consultant. And I was like,
Right.
and I said, a lot of times this is where we do fall short. We don't listen to our team that probably
Hmm.
would, I would tell you the same thing as, again, going back to getting the team all on board first, but getting their opinion, I think is a great thing to do.
Yeah.
So I just appreciate you caring for your team as much as you do. That says a lot, and I think this, if the doctor say, what's the one thing that I need to make sure I do when I get out of school, and it's take care of your team, because you'll
Hmm.
attract really good people and you want to keep them. And I think what we've done today is really give them the pearls of how to keep the team, right? Because the last thing you
Right.
want is really have a great assistant and let them go. One of the things I see a lot right now is the older assistants retiring, where they're tired, they're tired, they're broken. What are we going to do to keep them? Because once they walk out that door, you are not getting them back. And I think
Right.
that's the issue is I might be 55. I've got Ava, and she just retired at 69. I'm like, why did you retire? She said, you know why? Because they felt like they didn't need me anymore. And that broke my
Yeah.
heart because let me tell you, this woman has mad skills and she can run circles around any dental assistant trimming professionals that I've ever met. And they just let her leave. Are you crazy? So these are the things that, again, we might be getting older, but, keep them. We'll stay as long as
Yep.
you stay if we're treated right. And I think that's, again, this is just another thing, giving us something to learn, elevating this skill set, and most importantly, giving that appreciation goes so far.
So, Shannon, how can people find you if they're interested in your courses and all that stuff? How do people find you?
Thank you. It's called Chairside Assisting. Super easy. Just chairsideassisting.com. And
Okay.
they can get on there. They can actually, email me. They can call me anytime. Listen, I'm all about that. Any questions, and most importantly, all of the information is right on there. Our subscription, everything's a subscription-based model. And it's just super easy to navigate. And if I can help in any way with anything, and sometimes I might not know the answer, but we'll find it. That's who we are. And I thank you so much for having me today and letting us have again an extended voice for dental assistants because it really is needed in this day and time.
It really is. I agree with you. Everybody, this one's a wrap. Thank you, Shannon, for
Thank
for
you.
giving me your time. And for all of you watching from the bottom of my heart, thank you. We're having some great success with the podcast, and that doesn't happen without an audience. So thank you to all of you. This is Technology Evangelist Podcast. I'm Dr. John Fluke. We are sponsored by Medidenta Digital, and I am so grateful for all they're doing to help bring this to you. So take it easy. We'll see you next time.